When a patient undergoes the extreme physical trauma of major surgery, the standard clinical response is immediate, a heavy, strictly managed regimen of pharmaceutical painkillers. But those post-operative narcotics trigger a severe cascade of secondary issues. They often lead to reduced mobility, deep disruptions to natural sleep cycles, and extreme spikes in chemical anxiety. This loss of physical stability carries massive, often unspoken risks. Every year, roughly 1 million patients fall in a hospital setting, and 10,000 of them die as a direct result of the head injuries sustained from those falls. The traditional recovery model essentially forces an impossible choice. We attempt to manage the initial trauma of surgery by exposing the patient to the secondary dangers of narcotic dependency and severe physical instability. Dr. Anna Toker, an award-winning colorectal surgeon in Dallas, Texas, understood these stakes perfectly. But she was also dealing with her own crisis, debilitating psoriatic arthritis that caused so much pain she might lose her surgical practice entirely. Searching for alternatives, she tested a drug-free, non-invasive adhesive skin patch on herself. The effect was immediate. The severe physical pain symptoms that were threatening her career were effectively eliminated. Because her own symptoms cleared up so effectively, Dr. Toker took the logical next step. She completely rewrote her clinic's enhanced recovery after surgery protocol, the specific pre- and post-operative steps her patients take to heal. Her new protocol removed the heavy post-op narcotics entirely. Instead, her patients now rely on this simple Class 1 FDA-registered physical therapy device to manage their recovery. How exactly can a drug-free piece of plastic replace heavy pharmaceutical pain management drugs in an intensive surgical environment? There is no medicine, no chemical footprint, and no magic involved here. The technology operates entirely on the biological principle of the piezoelectric response. This animated diagram shows the secret. Every patch has a proprietary physical pattern etched into its surface. When those ridges contact your skin, tissue mechanoreceptors translate the vibrational energy of that pattern into an electrical signal. That electrical wave travels up a sensory nerve, moving straight into the dorsal column, the part of your spinal cord responsible for balance. From there, the signal bypasses conscious thought entirely, traveling from the spine directly into the foundational brainstem. By converting physical sensation into a neural impulse, the patch creates a direct line of communication between tactile touch and the brain's autonomic regulatory center. Because every patch features a unique etched pattern, the resulting electrical signal penetrates to different depths and specific regions of the brain. The Liberty patch signal travels to the cerebellum. As it lights up this section of the brain, it restores proprioceptive balance, effectively neutralizing the risk of post-op hospital falls. With the Peace patch, the signal reaches the amygdala. It forces the autonomic nervous system to switch out of a high-stress fight-or-flight mode and into a parasympathetic state where actual cellular healing can occur. And the REM patch sends its signal forward toward the hypothalamus. This slow, rhythmic pulse naturally induces a state of deep, restorative sleep, entirely without the use of chemical sedatives. In practice, these patches act as a passive touchstone. They provide a constant physical reminder that prompts the brain to remember what normal balance, calm, and sleep feel like, without the patient needing to actively meditate. For medical professionals evaluating this tool, there is a vital clinical distinction to maintain. These patches do not cure diseases like multiple sclerosis or diabetes. In a clinical context, a disease is a state of end organ damage. A physical therapy device cannot magically reverse that level of permanent damage. Instead, the patches are designed to treat symptoms. They work by reeling in rogue neurological pathways before that permanent organ damage has the chance to set in. And because they completely bypass the digestive system and carry zero chemical footprint, a patient can wear multiple patches simultaneously to achieve a synergistic effect for different symptoms. This provides physicians with a zero-risk, high-reward physical therapy tool to proactively manage severe symptoms without the side effects of traditional pharmaceuticals. If you are a healthcare professional looking to improve your own patient outcomes, we invite you to examine the underlying clinical data for yourself. Call R.S. Mallory's private line at 512-843-3412 to discuss the clinical specifics of integrating this protocol into your own practice. If she is currently in a consultation when you dial, please leave your name and the best time to be reached for a personal callback. This is an exclusive peer-to-peer opportunity to upgrade your clinical approach and deliver superior recovery outcomes for the patients who rely on you.